I'm now going to demonstrate my thoracic examination. So let's assume our patient already came into the clinic and presented us with a full subjective history. If there was any indication of radicular pain, myelopathic pain, or referred pain, we'd want to perform a full upper quarter screen as well as a sympathetic slump test. Let's assume that's all clear and now move into active range of motion of the thoracic spine. So let's have our patient positioned with their hands interlocked behind their head with their forearms underneath their chin. Is that a comfortable position?
Yeah.
All right. We then want our patient to slump down to accentuate the thoracic spine and start with thoracic flexion. Now before we do this, if we have any osteoporotic patients or osteopenic patients, we want to avoid thoracic flexion as this could cause a compression fracture. So let's go ahead and do some thoracic flexion. Is there any pain with that?
No.
All right. If there's no pain, we want to provide an overpressure. Good. We then want the patient to come up into extension, extending the thoracic spine. Any pain with that?
No.
If there's no pain, we want to perform an overpressure. And we can do this at different ranges for thoracic extension with our stabilizing hand, moving down the thoracic spine, so moving caudally and stabilizing as I lift up into extension. Next, we can go ahead and do side flexion. So have our patient maintain that same grip but move their hands out to the side. Let's start by side flexing to the right. If there's no pain, provide an overpressure. And the other side, if there's no pain again, overpressure. Good. We then want to do rotation. So have the patient hug himself, slump down, and rotate. Good. If there's no pain, overpressure, and again, overpressure. Good. So that's your active range of motion for the thoracic spine. Let's move on to passive accessory testing now. So I want my patient in prone with the shirt off. All right. We want to start with central posterior to anterior mobilizations as our assessment technique using our pisiform grip. Work down the spinous process. Okay, right here we're assessing for concordant pain. If we elicit any pain, we want to perform repeated motions into that pain to see if there's any change in symptoms. So moving all the way down the thoracic spine, I'm moving a little quickly for the purpose of this examination video. We then want to perform UPAs using our thumb grip. Again, work all the way down on the facet joint. Okay, we then want to go to the other side. While we're doing this, again, we're looking for concordant pain. Repeated motions are performed if there is pain, and we want to see if there's any alteration in those symptoms. After UPAs, we want to go on to mobilizations of the costotransverse joint. So find the facet again, slip off just laterally and slightly inferiorly, and let's mobilize on the costotransverse. Again, moving all the way down. Assessing for concordancy. Again, repeated motions are warranted if there is pain. Again, all the way down the other side as well. And that's for our prone passive accessory exam. We then want to flip our patient over. Good. Now we can mobilize the costosternal joint. So these are unilateral anterior to posterior mobilizations. So these are very sensitive, so go gently on the costosternal joint and move all the way down. And the opposite side, as always, assessing for concordant pain. Take your time and perform repeated motions if there is pain and see if there's any change in symptoms. That's our passive accessory exam. So let's move on to our muscular exam. Again, I'm going to have my patient flip over. So it's very important in the thoracic region to assess for muscular strength of the scapular stabilizers. So let's first examine the lower trap. So have the patient extend their hands over their head just like that with their thumbs up in the air. I'm then going to ask him to resist my force. Good. And test the opposite side as well. We then want to do rhomboids with the hands out to the side with the thumbs down. And resist. Good. And that's rhomboids. Assess the other side for weakness. For mid-traps, same position, thumb up. And relax. And that's our muscular strength exam. In the same position, we can palpate around to see if there's any excessive tenderness in the erector spinae muscles. We can move down here. We can check under the axilla, check the rib. And we're just assessing for tenderness. Okay? And that's our muscular exam and our palpation exam. So there's limited special tests available for the thoracic spine. You can assess the kyphotic area, see if there's any excessive tightness or restriction there as well. And that's primarily our full thoracic examination.